So, welcome to hashtag Post-COVID Life, an awareness initiative by Together We Can, Nagpur Municipal Corporation, GFS, and Rotaract 3030. Today, we are going to talk on one of the alarming situations which Nagpur city is facing, that is post-COVID life. And we have with us Dr. Arbat, pulmonologist, to answer the questions related to post-COVID. So, welcome to the show, sir. So this is an initiative where we want Nagpurians to understand about what is post-COVID, what kind of rehabilitations need to be considered, recoveries, what is the speed of the recovery, and what measures we have to take as a recovered patient. So my first question to you is, what are the long-term effects of COVID-19?
Yeah. So I believe this is a question which everybody is been talking about as to what are the long-term effects, mostly with people who have themselves suffered with COVID or who have family members who had suffered with COVID. So when it comes to long-term effects of COVID, there are few things that we need to understand about COVID before we go towards the long-term effects. So what we have understood till now regarding the SARS-CoV-2 virus and the COVID-19 disease is pretty much incomplete. It's just been a year and a few months that this disease has been witnessed by the world, and whatever research and all has been going regarding this disease is somewhat not completely reached a conclusion. So what happens is, whenever we talk about COVID and post-COVID, it's a rapidly evolving situation. Like most of you must be knowing that there's a lot of emphasis on HCQ tablets in the beginning, and then it was told that they don't work at all. So similarly, whatever we'll be discussing today might have some changes in the coming time. So when it comes to the SARS-CoV-2 virus, on a very basic molecular level, what is understood is that the virus gains entry inside the human body cells through the ACE2 receptors. These are basically angiotensin converting enzyme receptors. So whatever body organ has these receptors are the organs which are affected more by COVID, which includes lungs, the heart, the kidney, the liver, and even parts of the brain. So I am telling you all of this so that we have a better understanding what exactly happens in COVID and post-COVID. So now when we talk about post-COVID, so it's not only limited to lungs. It can affect your heart, your liver, your kidneys, and even your brain. So when we talk about post-COVID, these are mostly the patients who have had COVID and have recovered from COVID, but are still experiencing some symptoms. They can be mild or they can be severe also, or patients who have had a COVID infection and have not recovered till now. So these are the people whom we in medical terminology call as long COVID. So there is post-COVID and long COVID, which mostly overlaps. So these are the people who have had COVID, but it's been a duration of a month, 2 months or 3 months, but they are still experiencing few mild symptoms. Most commonly is fatigue, body ache, malaise as in feeling of unwellness, then breathing difficulty, dry cough. So these are the mild symptoms that a lot of people are experiencing. Then there are some more severe symptoms wherein people are landing up with brain issues like stroke, seizure, or very rare symptoms like Guillain-Barré syndrome or Alzheimer's disease. There are many people who are now coming up with kidney disease after having a COVID infection. And there are some neurological and psychological complications also. So when we talk about post-COVID, these are the people who have had COVID infection, recovered, but are still experiencing some other medical problems. So that is post-COVID.
Correct, sir. So as you mentioned, that post-COVID is something which is very alarming and it's very diverse. The problems increase What is the current approach of the city in consideration of the post-COVID? Like when we saw COVID, number of beds were increased in certain hospitals, certain equipments were brought up. So, do you think that there will be a setup change for post-COVID or something needs to be get in the system?
Uh, when we talk about management of post-COVID, it's a multidisciplinary approach. As in, then there's a physician involved, as in people who deal with medical problems. Then there's a chest physician or a pulmonologist involved who are specifically specialized in lung treatment. Then there's a role of physiotherapist, specifically respiratory physiotherapist, who will guide the patient for strengthening their lung capacity. Then there are occupational therapists who will be guiding the person with how to go ahead with daily activities with minimum stress. And there is a role of a psychiatrist or psychologist who would counsel the patient regarding post-COVID complications, and a nutritional expert who can be a dietitian, who will then help the patient gain back the immunological and physical status that he or she had before having COVID. So this is the management of post-COVID. Uh, when we talk about our city, or when we talk about India as a whole, we don't have a centralized health system like UK has NHS, National Health System. We don't have a centralized health system. So when we talk about post-COVID management, it's purely based on which hospital is providing what services. But yes, there's absolutely no harm in coming up with a strategy for post-COVID management. I think so. Since we are talking about Nagpur city, the municipal corporation, so we should have a data bank of all the patients who've suffered from COVID, and these patients should be now then segregated into people who have any post-COVID symptoms, people who don't have symptoms, people who have severe symptoms in post-COVID, and accordingly we should have centers who will cater to post-COVID care. So as of now, what I see amongst the private and government hospitals, most centers have started what is post-COVID OPD, as in post-COVID outpatient department, wherein anybody who's had COVID in the past can go and consult a doctor regarding your post-COVID symptoms, and you will be treated as a post-COVID patient. And few centers, specialized centers, have cardiorespiratory physiotherapy. There are counselors who are there to counsel you for post-COVID care. But I think so a lot needs to be done when it comes to post-COVID care. Not in a spread out manner, but in a centralized manner.
Yes, correct. So I think now we can understand from the data we have and make a centralized system, especially for the city, and work in the post-COVID care. When the treatment was going on to the patients for COVID, a lot of medications were given in form of injections. The common name people know is remdesivir. Are there any side effects of those medicines?
Yeah. So before I answer your question, I would like to just elaborate on what are side effects. So medically, these are called adverse effects. So whenever a drug or a molecule is given with the intention of treating the disease, obviously every drug comes with certain actions which are adverse, which are not completely beneficial to the patient. So these adverse effects or side effects are classified into most commonly happening and which are frequently encountered, few which are encountered less than frequently, and then there are some rare side effects. So whenever we talk about side effects, it's the most common side effects that we are worried about. Rare side effects are, as they are rare, are the ones where we always see that the medicine should have a better ratio when it comes to advantage over the disadvantage. When we talk about the treatment that is given for COVID, specifically, I think so what you are talking about is the antiviral, which is remdesivir. Then there are injectable steroids, which have played a major role in treatment of COVID. Few antibiotics and some medicines which are supportive. Basically, they are given to take care of your heart or liver functions. So the side effects which are related to these COVID drugs are not still completely understood. It takes research of at least a year or two with the patient data of not thousand but lakhs to understand what exactly are the common side effects, what are the rare side effects. As of now, I think so there are not any major side effects with these medications that the common man needs to worry about. This I am saying because whenever we give a lot of emphasis on side effect, it somehow discourages the patient from going ahead with the treatment. So there are not many major side effects. Remdesivir has shown to cause some kidney issues for some patients. There are heart-related issues, but all of these are rare. These are not the common ones. And when we talk about common side effects, these are mostly indigestion, gastric intolerance, which are easily controlled with a basic antacid or some other supportive medication. Steroids is one medication which is talked about a lot. Steroids by nature are medicine which will raise your blood sugar levels. So anybody who's diabetic or has uncontrolled diabetes will see an adverse effect that whenever they are given steroids, their blood sugar are raised. This is what people are worried about, that steroid will lead to raised blood sugar. But then whenever we have a patient who needs to be given steroid, we titrate their diabetic medication accordingly so that the blood sugar are again brought into control. But yes, at times it's a catch-22 situation. You have to treat the patient, but you have to still deal with the side effects. But majorly, there's nothing to be worried about.
So it's mostly medically treatable. Like you can do certain things and manage both of it.
Yeah. So most of the post-COVID complications are not related to the medication; they are related to the disease itself. So yes, most of the side effects, adverse effects are manageable.
Correct. So my next question was, when we were in home isolation, asymptomatic patients were given a table or a chart that they have to monitor their SpO2 levels, their blood sugar levels, their BP.
Yes.
After you are recovered, are there any daily tests or monthly tests which the patient should go just to take precautions?
Yes, so whenever we talk about post-COVID, so as I told you, post-COVID symptoms are something which are very, as you said, they are diverse because a lot of organs might be involved. And the very scary part is people who had mild COVID or people who had asymptomatic COVID might also have very severe post-COVID complications. So it's not the case that only people who are elderly, people with comorbidities or people who had severe COVID might have a chance of post-COVID complications. Even the people who are completely asymptomatic are presenting with post-COVID complications. So everybody needs to be very careful with any symptoms or any difficulties that they are facing, which, as I had covered before, might be breathing difficulty, dry cough, issues related to the brain such as seizures or epilepsy, and issues related to the heart if you are having palpitations, people who are having symptoms of depression, and also people who are facing issues with kidney, which is basically either you have swelling in your feet, swelling in your face, or any issues related to urination and all. So these are the people who need to primarily consult a doctor, a physician or a chest physician at the earliest whenever you come across any symptom. Then, according to your post-COVID status, as in if you have a post-COVID mild symptom or moderate symptom or a severe symptom, that is when we can actually recommend a person how often he should get himself tested or how he or she should get himself tested. What we follow usually is after 15 days of your completion of COVID treatment, is when we recommend the patient to go for certain blood tests, which is basically a CBC, wherein we get to know if there's any more infection seen in your blood test. There are certain patients who had raised D dimer, raised serum ferritin, so they are advised to repeat the test after 15 days. Certain people who had a lot of comorbidities are the ones whom we recommend to go through all the tests, because they are prone for more complications. And there are certain patients who are requested to go for a CT scan after 15 days, just to get an idea as to how much of the COVID involvement in the lungs, which is basically pneumonia, is still remaining, how much of it is cured, and how much is now left as fibrosis.
So we understood that how often they should visit a doctor, and people who had already problems with their other organs, they should go to a doctor, consult.
So everybody who's had COVID should visit your consultant, your physician after 15 days, and that is when a plan will be decided for you as to how often you are supposed to get yourself checked and how often you are supposed to get yourself tested.
So it's very individual specific.
Yeah, it's a tailor-made approach rather than a blanket approach.
Post-COVID, a lot of patients showed shortness in breath, asthmatic conditions, sometimes blood clot issues. Is there any generic treatment for it, or how these patients should proceed?
Yes. So for this question, I'll take up more time of yours, because I think so. This is the main question that we are talking about. So as I said that primarily the organ that is most commonly involved are your lungs, and what we see in COVID is that you have something called pneumonia. So the virus has now affected your lungs in a way that there are some changes in your lung which has led to pneumonia. Pneumonia usually can be viral, can be bacterial. We've always heard about tubercular pneumonia. People who have tuberculosis, they have pneumonia. Now we are talking about COVID pneumonia. So these are changes in your lungs which show infection in your lungs. So pneumonia most probably progresses in two ways. Either it goes for resolution, as in your lungs are back to normal, or it leads to fibrosis. So the part of the lungs where you had pneumonia is where now you will see fibrosis, which is basically now your lungs have turned into something which cannot now exchange air, which is what we call as fibrosis. It's hardening of the lung. Your lung is by nature a very soft, spongy organ which takes in air and sends the oxygen from air to the blood and carbon dioxide from the blood to the air, and that air is exhaled out. So lungs have enormous capacity of expanding and contracting. A very interesting part is if a person's lung is opened up into one spreadsheet, it can cover a tennis court. So that is how many folds a lung has inside. So it's a very elastic structure. So when it loses its elasticity is when we call it as fibrosis. So fibrosis is the part of your lung which is now not completely involved in air exchange. So your oxygen exchange capacity is somewhere stopped wherever the fibrosis is. So that's why you must have heard that people are told that okay, now your lungs have certain level of fibrosis, and that will impact your health status. So this is the fibrosis which often leads to breathing difficulty. I don't think so it's asthma as such, but asthma is a term which we commonly use for breathing difficulty. Breathing difficulty is seen in various diseases such as tuberculosis, bacterial pneumonia, asthma, COPD, bronchiectasis. So what we call this is post-COVID fibrosis leading to breathing difficulty. Asthma is a individually different disease, and dry cough is another symptom related to respiratory. Dry cough is what we encounter in almost all post-viral diseases. Even when we talk about influenza, swine flu, So most of these patients after recovery have dry cough for a month or 2 months, and it just requires basic symptomatic treatment, a cough syrup or a cough suppressant. Nothing to worry about there. This we are talking about the lungs.
Yes.
Now when we talk about the heart, there's not a complete understanding, but most patients have something called arrhythmia, which is irregular heartbeat. So COVID leads to irregular heartbeat. And there have been some research studies, imaging studies, which have showed that COVID affects your heart muscles. So it does affect your heart. People who already had heart issues are the ones who succumb to COVID because their hearts are already under a lot of stress, and now COVID is adding more onto the stress. When we talk about post-COVID, people might come up with heart issues which they never had before. So that is why after 15 days, whenever you visit your doctor, you will be asked certain questions which would cover if you have any symptoms related to the heart or not. And then you might be recommended a test, maybe an ECG or a 2D echo, which would scan your heart status. That's related to the heart. Then we come to another major organ, is the brain. So brain is something which has been the most surprising, because a lot of people while having COVID have had a brain stroke, which is similar to a heart attack, and then they have had loss of power in their limbs, maybe loss of power in their legs or in their one part of their body. They've had epilepsy. So epilepsy has been something which is quite common with COVID patients. Very rare syndromes such as Guillain-Barré syndrome, Alzheimer's have been encountered in post-COVID also. And I've had patients who had COVID, mild COVID, and after 1 or 2 months of treatment, they landed up in a complete blackout. Some patients have landed up in a epileptic attack who never had these symptoms before. So brain is another organ. What I think so everybody talks about is blood clots. So COVID is a hypercoagulability state. So anybody who has COVID has higher chances of having blood clots. Now the worry with blood clots is they can travel to any part of your body.
Yeah.
So when they go to your brain and they end up blocking a very essential artery, something which is supplying blood to certain part of your brain. So you will have brain related issues. If they go and block up a part of your pulmonary vasculature, as in the blood vessels which supply blood to the heart to the lungs from the heart and back. So they'll lead to pulmonary complications. If they land up in kidneys, you will have kidney related complications. We've had a lot of patients coming with DVT, which is deep vein thrombosis, which usually is caused due to lack of mobility or certain other causes. But now COVID has turned out to be a major cause. So people who had blood clots which need to be removed, filters need to be put inside their major blood vessels. So blood clots is another problem. And then we come to a completely different part, which is the psychological part, which I think we'll discuss later.
Yes.
So now when we've covered post-COVID, so when it comes to blood clots, so you are given specific medication which will prevent blood clots. So if you have severe COVID, moderate COVID, if you are admitted in the hospital, so you will be given injectables. If you are at home and if you are prone for blood clots, then you will be given tablets. So very often we recommend our patient to continue these tablets for 15 days or a month for the same reason that they might have blood clot related issues post-COVID. So you've recovered from COVID, but you are still advised to continue these anticoagulant tablets at home for 15 days or a month. So that's how you can prevent the part of blood clots.
Correct.
When we talk about heart, obviously you should convey any symptoms that you have related to heart to your physician, and you would be advised a 2D echo, which would be a scan of your heart, which might pick up any issues related to the heart. And when it comes to lungs, I think so everybody who's had COVID should undergo a very basic test called lung function test. We call it spirometry. You're supposed to blow into a machine which is connected to a computer, and it will tell you what is your lung function right now. So is your lung function 80% of predicted? Is it 70%, 60%? Can be easily understood by a 5-minute test called lung function test or spirometry. And accordingly, you might be started on inhalers, you might be started on certain other medication. So a basic visit to your physician, a lung function test, a blood test, a CT scan, a 2D echo for your heart issues. These are the tests I think which would help in anticipating any complication, and medications related to blood coagulation, inhalers for your breathing difficulty, any antibiotics if they need to be continued, and multivitamins are the medications which can prevent any complications. But we can never be completely sure.
You cannot predict. So I hope the audience is understanding how how quick they have to be of what they are observing in themselves and approach the doctor, and these are all treatments can be given to these things. During COVID, as you also mentioned, mental something was going on. A lot of people faced depression, stress, also because they were in hospital for a very long time, 14-day period, 5-day period, 7-day period, and when they came back, they were in one room, eating in different plates and disposable. All the preventive measures they were taking, it was causing them stress, anxiety, and also one thing came up was discrimination, which is not good, but just a lot of people were like, if that home has a COVID patient, just don't go.
Yeah.
So
avoid
going, avoid visiting. So the family was also facing a different. The whole morale was down. So how can recovered patients, family members cope up with this depression, stress, anxiety problems?
Yeah. So I would like to first start answering this question by the fact that I am a pulmonologist. I am not a psychologist or a psychiatrist. The reason I am specifying this is due to some very unfavorable reason. People take mental health very casually, and you must have seen a lot of people will give you advice regarding your mental health just like that, which should not be the case. If you have any issues related to mental health, you should approach a psychologist or a psychiatrist, because what you need is proper counseling from a person who's trained in that subject, rather than getting advice from random people, or even a person like me who is not specialized in psychological studies. So that's the first thing that everybody should understand. It's fairly common to comment on depression on Facebook, WhatsApp and all, but depression or anxiety is something which is as serious as COVID, heart attack, brain seizure. So you should take advice from the specialist and not from somebody who can just guide you for 5-10 minutes, but that's not the way to go about it. What are the various symptoms related to COVID? I would like to enumerate so that a lot of people who are watching can connect with it. So as a doctor, what I had encountered was the fear. A lot of people just have a lot of fear when it comes to COVID. Mujhe COVID ho gaya. So the disease is one part, but the fear of getting infected is a big part. Yes, which is I think fairly justified, because nobody should take COVID lightly anyways. There have been issues related to home isolation. I've had a lot of patients who are husband, wife, both are infected, both are isolated in their rooms, they have children, the help has stopped coming to the home because he or she is now scared of getting infected. So basically the children are by themselves. This takes a lot of toll on the psyche of the parents and the children. There have been senior citizens who have their children working abroad, maybe in the US or UK, and they've been infected. Again, the help or whoever was there to assist in domestic activities has stopped coming. So people at above the age of 70 or 80 now have to clean their utensils, clean their home, wash their clothes, which they are not used to. This has been another problem. We've had a lot of patients who were admitted in the hospital, admitted in the ICU, and what we call is ICU psychosis, or basically symptoms specifically related to the ICU. Because unlike any other disease wherein you might be admitted in the hospital but your family comes and visits you every day, twice a day, once a day, in COVID that's not possible. So people have been admitted in the hospital with absolutely nobody to meet, nobody to talk to, often seeing patients getting more complicated when patients around them. So there's been a lot of psychological issues for patients specifically who have been in the ICU, and there have been cases of post-traumatic stress disorder with PTSD. So people who have had severe COVID and have recovered have had a near-death experience, and this has been a big problem because that also is a very unhealthy experience to go through. So these have been some problems. And then coming to the stigma, somebody in your family or in your apartment is COVID positive, and their door now has a plate which says that COVID-19 patient stays over here, or buildings are completely isolated, or homes are completely. They were putting some I think asbestos sheets around the homes and all. Humans as such are social animals, and any disruption in your social activity is a major disruption on your psychological health. Even the fact that a lot of people have stayed home for a long period of 4 or 5 months, people have not gotten the chance to do something very basic. I know these are very frivolous things, but visiting a movie theater, seeing a movie with your friends, going out for a walk, going to the restaurant, celebrating your birthday, your friend's birthday, going for that once a year holiday. You might be going abroad, you might be traveling inside the city. People who've been working from home, people who are used to going to the office in the morning, coming back, now they are completely cooped up inside a room with a laptop. A lot of teachers who are otherwise used to communicating with their students in person. I've had a lot of teachers who say that now when they're teaching, they just see 40 dots on the screen. They don't see their students. That is not a healthy way for them. So these have been the psychological problems, and the only answer to this is proper counseling, which has to be done via a psychologist or a psychiatrist. You can do it via telemedicine, you can do it with your laptop, you can do it with your phone, but absolutely no one should take their mental health casually. You seriously don't know what all mental trauma or what all mental difficulties you've been through in the past few months, and you should prioritize your mental health. Consult a psychologist, a psychiatrist, get proper counseling, and get proper treatment if it is required. You should not shy away from the fact that yes, you are anxious, you are depressed. Unfortunately, people around us, family members they are supportive, but people tend to dismiss these symptoms and these diseases. People tend to say कि नहीं नहीं टेंशन मत ले, depression नहीं है, but it might be depression, and depression is not treated by talking to your family members. It is treated by proper methodology, which comes from a psychologist or a psychiatrist, and might require some medication which you should not avoid. Anxiety is another problem. I said post-traumatic stress disorder is another problem. So mental health is a major component when it comes to COVID, and it's not issue worth Facebook or WhatsApp. It needs you to consult a doctor.
Completely, I think from basic like not going out to family members to patients coming from ICU, seeing maybe death in front of them, even kids losing their parents are losing some family member because of COVID.
Even kids who've not stepped out in the past 8 months are there are cases of children age group of 2 years, 3 years, and 4 years. Now, when they're stepping out, they're scared.
Yeah.
Because a very basic function of your brain, part of your cognitive behavior is meeting people. So there are children who have not met people in the past 1 year. They have not gone out to play.
Yes.
They have just been inside their homes. This is also a big issue. So it's not that somebody's died in your family and that will take a toll.
Yeah.
Just the fact that you could not celebrate Diwali or you could not celebrate Christmas might affect you severely. So this needs to be addressed in the right manner.
Right manner. From very small things to very big things. I think the audience should understand that they should consult a specialized person and not treat themselves.
The audience should first identify that there is a problem.
Yes.
Dismissing mental issues is, I think, the most common thing that we do.
Biggest problem, yeah.
We say कि हाँ थोड़ा stress है वो ठीक हो जाएगा करके, but stress itself is classified in various ways. So you need to identify and then you need to address it.
A lot of people faced the O2 levels were going down when there was COVID, which scares you kind of, because when you have to walk, when you have to especially go to the room or use the loo, you cannot breathe properly. That sometimes causes claustrophobia or some other kinds of phobia. So even post-COVID, when they come to their homes, to shut them in a room, they get scared.
Yeah, yes.
So how can they cope up this? Should they address any specialized person, or how to approach this problem of having phobias?
So when we talk about these issues, the root of these issues is basically breathing difficulty. So on a very general basis, respiratory health has always been ignored just because we are just not inclined towards prioritizing our health. A lot of issues gain more importance. At times it's education, it's your career, it's your finances. Sometimes it's just your fashion or what kind of a car you drive and all. But health has never been a priority. I've never met a person who is boasting to his friend that all my health parameters are great. So I am proud of that. That's never the case. I've never met a person who would say that I do my yearly health checkup and that's my priority. That has never been the case. So not prioritizing your health sometimes just surprises you. When it comes to respiratory health, breathing difficulty is somebody is choking you, somebody is not letting you breathe.
Yes.
That's a very discomforting feeling. So people who've had COVID often have breathing difficulties, and that feels majorly like a major disability. When we talk about oxygen levels, it's a very fairly easy science. Anybody who's got perfectly functioning lungs, which is you and me right now, we take air from our surroundings, and that is sufficient for our oxygen requirement. Anybody who's had mild respiratory involvement, mild involvement of the lungs, will require oxygen through a mask or through nasal tube. When it progresses to more involvement of the lungs, then you require a BiPAP machine which will send air through a pressure. And when your lungs are majorly involved is when you require a ventilator. How do we judge all this? Is by seeing your oxygen levels. So when you are at home, you are recommended to use a pulse oximeter which will tell your oxygen levels. When you are in the hospital, a blood gas test will be done which will show your PO2, PCO2 levels. Coming to the pulse oximeter, whenever you keep it on your finger, leave it for 30 seconds.
Yes.
You put it on, it might show something around 60, 70, 80. Leave it for 30 seconds, and what you see after 30 seconds is your actual SpO2 levels. This is what a lot of people get scared because they put it on and they say, oh my god, it's 50. Yeah. But you keep it for 30 seconds, it might come to 95. So that's how you should use a pulse oximeter. So post-COVID patients are advised to keep continuing monitoring their oxygen levels, their blood pressure or body temperature. When it comes to claustrophobia, post-COVID phobias and all, again we come back to the part that consult your physician. If you have breathing difficulties, you will be advised treatment for the same. If it has any part of psychological component, it will be treated by counseling or medication. Other than that, there is something called rehabilitation. Rehabilitation has always been around, but again, not many people are aware about it. Whenever you have any issues related to the heart, if you have a heart attack, what you go for after a heart attack is a treatment for your heart attack and cardiac rehabilitation. Similarly, if you have COVID, you will go for a COVID rehabilitation, post-COVID rehabilitation, which will comprise of majorly respiratory rehabilitation, some part of cardiac rehabilitation, and some part of mechanical rehabilitation. So people who had weakness because of muscle loss, because of dehydration, will be advised certain exercises which will help them strengthen their muscle. People who've had lung involvement, whose basically CT scan show fibrosis or whose spirometry shows lung function deficit, will be advised some breathing exercises which will strengthen their respiratory muscles, which will basically let them do more activity with less oxygen consumption. And last but not the least, you will be given some nutritional advice which will help you gain back your muscle, gain back your strength. So rehabilitation comprises of all of this, and rehabilitation is the answer for a lot of symptoms which don't require medication.
So I think it's more about prioritizing your health.
Always. I think so. COVID has been an alarm bell for all of us that if you don't give due importance to your health, it might cost you a lot. As in, unfortunately, these pandemics are usually a very basic nature of very basic part of nature, which is the criteria of exclusion and the survival of the fittest. So people who've had a lot of diseases are the ones who are succumbing to COVID. Mostly people who've taken good care of their health, people who've been fit, people who've been active, are the ones who get COVID and also recover well. So yes, I think so. With COVID now, we have to prioritize health.
And it has come up when youngsters going for interviews, you have to do a health checkup test before you're recruited by a company. So now we see a change in the format that health is being prioritized, and things we have mentioned in this session and the talk show, that you, even post-COVID, even after recovery, you need to make sure that you're doing well with certain things. You address not only your physical health but your mental health. My next question to you is, is there any particular age group which will be at very high risk considering post-COVID life, or it is a very general, all age groups can face these common difficulties? Is there any particular age group?
Whatever data has come from all over the world, that is Europe, both the Americas and the Asian subcontinent, is it can affect any age group, but definitely beyond doubt, people above the age of 60 have to be extra careful. If you have a family member who's had COVID and he or she is above the age of 60, you have to take extra care. Make sure that that person again consults a doctor regularly, gets his tests done. Get yourself enrolled in a rehabilitation program. Thanks to telecommunication, you don't actually need to go to a doctor to enroll yourself in a rehabilitation program. A physiotherapist can actually demonstrate what all exercises you are supposed to do while you are sitting in your drawing room or your bedroom, and the physiotherapist is in the clinic or in the hospital. So you don't need to step out for that. So get yourself enrolled in a rehabilitation program. People above the age of 60 have to be extra careful. And coming back to health, I think so. People above the age of 40 should get a yearly health checkup. This is completely irrespective of you have COVID, you not have COVID, but get a yearly health checkup. Most of the diseases are either controlled or cured when they are picked up early.
Yes.
We just require a basic health checkup. It does not cost more than 4,000, 5,000 rupees, which very often is your restaurant bill when you go for a lavish dinner.
Yes.
So it saves you a lot of money if you just go for a health checkup.
So yeah, this related to the second question was, what are the preventive measures the patients should take, irrespective they have COVID, they don't, in the future?
Yeah, so when we talk about the future, I think the first thing that we need to clarify is we are not done with COVID.
Yes.
I know we are discussing what is post-COVID, but we are still in the middle of COVID.
In the middle of COVID.
Nagpur is in a lockdown. Most of the hospitals are out of their bed capacity. We are out of ventilators. There are no ventilators for patients. So post-COVID is important, but we are still right in the middle of COVID. When it comes to precautions, what we had learned last year in February still stays the same. Wear a mask. I think the best machine, the best mechanism, or the best invention that we have for these infectious diseases is a mask. So wear a mask, wash your hands regularly, use a hand sanitizer, avoid crowded places. If you have any symptoms, it's better that you get treated before you step out, rather than you have symptoms, you're stepping out and you're spreading the disease. So wear a mask, wash your hands regularly, use a hand sanitizer, avoid crowded places. If you have any symptoms, don't take them lightly. Consult your doctor. This is all when it comes to COVID. When it comes to non-COVID, otherwise, you should exercise regularly. A healthy person requires at least 2 sessions of 30 minutes of activity every week. So you need not go to the gym, you need not go for Zumba, but 2 days a week you should spend 30 minutes doing an activity which leads to at least perspiration or increased heartbeat.
Yes.
This I am specifying only because a lot of people are now used to sitting on a chair and taking deep breath, and they feel that that's enough exercise. But no, unless and until you have some severe heart issues or any disability, you should give 20 minutes twice a week. A good healthy diet obviously helps you prevent a lot of diseases. You are what you eat, so a healthy diet will keep you healthy, which basically means is healthy carbohydrates, avoiding sugars, avoiding excessive oils, excessive fat, right amount of protein depending on the type of diet you have, and obviously avoiding any kind of addictions.
Yeah.
So healthy diet and exercise is your best prevention for most of the diseases.
Yes. So COVID appropriate behaviors, exercise well, and exercise according to your health situation.
If you are a patient of post-COVID, don't go for exercise right away.
Yeah.
Consult your doctor. Go for a ramp method. As in ramp method is, if you have started walking, go for a 5 minutes walk for the first week, then go for a 10-minute walk in the second week. Don't right away go for a 1 hour walk. You might end up in trouble. So if you are post-COVID, consult your doctor. Start with very light exercise. Otherwise, to prevent any disease, exercise and diet is the key.
It's the key. So we are moving towards a conclusion. We understood post-COVID just because in any problem, the major solution starts from identifying the problem.
Yes.
And if after your recovery, you identify the changes you're having in your body and approach the doctor, maybe the solution is easier. With certain medicines, it can be treated. So, any concluding remarks, any message to the audience which they should follow, considering post-COVID life, or even as you mentioned, we are still in the middle of the pandemic?
When we are talking about post-COVID, the conclusion is don't ignore any of your symptoms. Please don't forget that post-COVID majorly involves all the organs. It's not limited to lungs or pneumonia or breathing difficulty. So it can be anything.
Anything.
So don't ignore your symptoms. Make sure you consult your doctor regularly for post-COVID care, and go for rehabilitation, proper rehabilitation, and get yourself tested as in what your doctor recommends. That's the case for post-COVID. Don't ignore your mental health. Eventually, you might recover from your physical health issues. Mental health might be troublesome for maybe 5 years or a decade. So don't ignore that. Identify any anxiety, any kind of depression, sadness, any kind of anger, or if you're feeling hopeless or if you're feeling defeated. Identify these symptoms. Consult a specialist for your mental health. And since we are in the middle of COVID, wear your mask regularly, wash your hands regularly, use a hand sanitizer, avoid crowded places. If you have any symptoms, consult your doctor and isolate yourself.
Thank you so much, and I hope Nagpurians are understanding that to address the pandemic, to move forward, we need to follow COVID appropriate behaviors, because if we are safe, our family is safe, the city is safe, and then our nation is safe. So thank you so much, and hope our audience understands post-COVID life, and we are still in the middle of the pandemic, and the importance of not only physical health and its recovery, but majorly also mental health and its recovery.